Good morning, everybody, and a very warm welcome to all of you joining us this morning. Apologies for a short delay. We were having some tech issues, but all sorted out now. And make yourselves comfortable, and we'll be starting shortly. I am Tanya Arlington, Event Director at Workplace Wellness Festival, and super excited to be kicking off the first of our pre-event webinar series with you today. The webinar will go for around 40 minutes, which will be followed by a Q&A session moderated by WellTech COO James Gillett. You'll notice on the right-hand side of your screen, there is a chat section. In the stage chat, you'll see there's a Q&A section where you can forward your questions for the Q&A session. In the meantime, I can see you all using it and saying hi. It's a great place to connect with others at the event and to also comment throughout the presentation. Today, we'll be hearing about what the future workplace may look like as COVID-19 becomes endemic versus epidemic. We're incredibly pleased to be welcoming to the stage leading physician and epidemiologist, Dr. George Gellert, who is the Chief Medical Officer at WellTech and is at the cutting edge of COVID response strategy with a lifetime of experience in epidemiology and population health strategies. Good morning, Dr. Gellert, and thank you so much for joining us this morning to share your insights on COVID-19.
Thank you, Tanya. It's a pleasure to be here, even though the circumstances are obviously not what we might want in our wellness community. I welcome everyone, and my objectives for our talk this morning are twofold. One is to give you some very practical, immediate value information in terms of what we're going to be looking at on issues regarding vaccination of the Australian population and others. But I also hope that we can achieve an objective of giving you a larger understanding of how the pandemic will play out moving forward, what are going to be some of the critical determinants with respect to how long we have issues around communicability in our countries and the world at large. So with that, I'll turn to a slide deck, and this will be made available to anyone who would like to have it subsequently. So my colleague Jeames is going to pull up the first slide. So we're really going to focus on what Australia can learn from the global COVID-19 response thus far. Next slide, please. So at present, as I'm sure you're all very well aware, Australia has been a leading nation in its COVID-19 response and performance. The government and the public at large responded to this in a rapid and aggressive manner that helped contain the spread of COVID-19, of the SARS-CoV-2 virus that causes COVID-19, in Australia to amongst the best in the planet, and saved many lives as a result. Next slide, please. This is a image really cutting across nations with illustrative groups. As you can see, unfortunately, the United States leads the world in morbidity and mortality, the level of community transmission. Brazil is not far behind the US and rapidly catching up. Then we see India and a number of the European nations clustered. India may yet increase. Obviously, Europe is dealing with its own surge at present. And then at the very bottom, really, where you see South Korea, that's where Australia, New Zealand, and other countries that really implemented really strong disease control measures, and there was public trust in the management of the pandemic, resulted in really low incidence on an ongoing basis over the first year of the pandemic. Next slide, please. This illustrates the same information using a colorized map, and the darker colors here are the most unfortunate in terms of actual mortality and morbidity, and the lighter colors represent countries who had, over a rolling 7-day average, over the last couple of weeks. We see that Australia is there very clearly in yellow. Sub-Saharan Africa, frankly, has been a surprise to many epidemiologists and public health professionals around the world. There are many theories now that are being assessed in terms of why when our expectations that it could be quite negatively impacted as developing economies with developing world public health systems, one might have expected stronger presence of the virus and greater deaths, frankly. And so far, that has not been the case. And the theories around that range from potential strong immunity due to so many other pathogens, communicable disease pathogens that are experienced over life. But the truth is, I don't think anyone yet has a really strong understanding of why sub-Saharan Africa has done as well as it has. Obviously, we hope that that continues. We'll talk more about the global situation in the balance of the presentation. Next slide, please. This shows COVID deaths per million. And again, darker color here, bright red, followed by the orange pink, and then the very light pink. And as you can see again, Australia, with a handful of other developed, advanced industrialized countries, has had a truly exceptional pandemic performance and outcomes thus far. Next slide, please. This gives you a snapshot of Australia's current situation. Having 29,000 total cases and less than 1,000 deaths as of last week is a remarkable achievement. Something to be very proud of, but on the other hand, as I hope will become clear, no reason for complacency. One needs to remain highly vigilant. We are not through this pandemic yet, and I don't think Australia is through, frankly, because one of the points that I hope will come across shortly is that this is very much we're all in the same boat together. It's insofar as there continues to be a raging epidemic in any country in the world where new variants can be mutated, those variants can represent a brand new risk to the world at large, including Australia and the US, of course. Next slide, please. So I thought to compare, a state with somewhat similar population size to Australia, and that would be California, which has a population of 38 to 39 million. And as you can see from that Australian snapshot, it's been devastating in California. There have been 3.6 million cases, almost 10% of the Californian population has been infected by COVID in this first year of the pandemic. And sadly, we've had almost 60,000 deaths, preventable deaths in significant measure. Very different situation than Australia, obviously. Next slide, please. So what I thought to do is just to get through a couple of pragmatic issues, and then we'll take a look at what is going to determine the longer term situation with respect to the pandemic. So I'm very quickly here going to run through a number of questions that I have no doubt some of your staff and your organizations may come to your employee health or occupational health units seeking information. And so we'll just run through these very quickly. These are widely available, this information, on Australia's national public health sites as well as most Western countries. First question is, if you've had a COVID-19 infection in the past, are you protected against it in the future, and should I still get vaccinated? So the answer is yes, you may be provided a period of protection from a prior infection with COVID-19, but it is not believed to be long-lasting. It will wane, and you may get reinfected. We've had instances of people who have been infected and who subsequently got reinfected before they were vaccinated. So that then leads to an obvious answer that everyone should consider seriously getting vaccinated, and it should be a situation where you need to have a really good reason, frankly, not to get vaccinated. Next slide, please. Which vaccine is the best one to get, and how long does it take to work and to protect me? So I'm aware, of course, as everyone is, about the problems with the J&J vaccine over recent weeks. But the answer to this question is the best vaccine to get is the vaccine that you can get and that you can get quickly. The overall protection provided by these vaccines on the two most critical outcomes, hospitalization and death, are almost equivalent, very similar, and not from a public health or clinical point of view, meaningfully different. So if you get the J&J vaccine, you're getting good protection. The risks of getting this side effect that has been in the news lately, this blood clot, is significantly lower than the risk of getting infected with this coronavirus. So get any vaccine you can as quickly as you can and as it's available to you. How quickly it works, typically 10 days to 2 weeks following vaccination, you reach full immunity. Now, if you're doing a 2-dose regimen, such as the Pfizer vaccine or the Moderna vaccine, that would be 10 days to 2 weeks after your second shot. That's when you will have immunity. It will protect you from that time on. Obviously, from the first shot, you're getting partial protection, but the immune system really does need another hit, if you will. It needs another provocation of your body's natural immunity to really build the full response to ensure that when you are exposed downstream in your life, it doesn't invade your body, infect you, and make you ill. Next slide, please. Can you get COVID-19 from the vaccine? Absolutely not. This is not an attenuated vaccine. There are only fragments of the vaccine, of the virus in the vaccine, just enough, including some of its messenger RNA, just enough to stimulate your immune system to respond to it. So there is an absolutely zero chance of getting a COVID-19 infection from being vaccinated. Next slide. What are the vaccine side effects? How bad are they, and how long do they last? So, like most vaccinations, there are really two categories of side effects. There's a strong reaction, called what we refer to as an anaphylactic reaction. That is someone who has, if you will, an allergic response to the vaccine. And that's why after vaccination, when you go, the site will ask you to sit down and just sit down and read a book or something, or look at your phone for 20 minutes or 15 to 20 minutes, just to ensure that that immediate serious reaction doesn't occur. Those reactions, serious reactions, occur at very low frequency. The more common side effects that most people will experience is soreness at the injection site, perhaps some fatigue, maybe some muscle pain, maybe some joint pain, maybe a little, just feeling a little out of sorts, like having a minor cold for a day. And that would subside usually in 1 to 2 days. If it persists beyond that, or if it causes you concern, even in the first days, beyond what I've described, then you, of course, should go and see your personal physician or go to an emergency room if you're particularly concerned and let them have a look at you. But for the most part, most people do not experience any serious side effects. I've had the vaccine, my family has had the vaccine, and the response was, reaction side effects were really minimal. I seem to have lost the screen here.
Sorry, George.
No problem.
I'm not sure what.
And so we just had a little bit of, muscular pain in our arms, like most people, and it subsided. And I have a couple of hypochondriacs in my family, so if it would have been worse, I assure you, I would have heard about it. Next slide, please. How long will the vaccine protect me, and will I need to get an annual booster shot? So the truth is, we don't exactly know how long the vaccine's protection is for, because we haven't observed it in vivo in life. And so what's going to occur is we're going to get an understanding of that as people who have been vaccinated, their immune levels are monitored, or the potential of infection is noted in people who have been previously vaccinated. The thinking, though, presently is that between the nature of this virus, the fact that there are variants that are emerging, that number one, we will need to have probably an annual booster shot to just recharge our body's immune response to the coronavirus. And we'll know that schedule probably within the next 6 months, as well as a solid answer to how long immunity typically lasts with the vaccine. What will be good, frankly, also is that there is thinking among the manufacturers that they might combine this booster with the annual flu vaccine. So you may not need to go and get 2 shots. You just get 1 shot, as you have been for flu over the past years, and you'll be covered for both of these serious potential viral infections. Next slide, please. Is it true that the vaccine can affect my DNA? So this comes from some people's concern that the virus is a messenger RNA virus. That's the nature of its genetic material. And so in the vaccine, there are mRNA fragments to stimulate the body's response to that. However, again, there is no chance of getting infected from the vaccine. But more importantly, with this question, the vaccine never penetrates your genome. It has absolutely nothing to do with your own DNA. And so this is a myth, urban legend, anxious fear, absolutely no truth to it, absolutely no risk of affecting your own genetic material with this vaccine. By the way, even though this is the first major mRNA vaccine, medicine around the world has been doing research on mRNA viruses and vaccines for decades. So it's a new vaccine, but it's not new science. And in fact, the result that we've seen, unprecedented revolution in medicine, that we were able to develop a vaccine to this pandemic in less than a year and be distributing it, is primarily driven by those decades of prior research. So this is very safe from every sense of the term as a vaccine, no impact potential on your genetics. Next slide, please. If I've had an allergic response to other vaccines, should I get the COVID-19 vaccination? So that's a question that I would recommend, and you must really ask your own personal physician. Go to your healthcare provider. If you've had that kind of a response in the past, you may be at elevated risk of having a significant reaction to the COVID-19 vaccine. So best to do that with the informed consultation of your trusted physician. Next slide, please. If I have a chronic medical condition, should I get the vaccine? So the answer is that for most individuals with chronic medical conditions, and most people in Western countries now, 45% of most populations in Australia, the US, Canada, have at least one chronic medical condition. Most people have some who are at risk, certainly, and they're getting the vaccine. It really depends on what medical condition you have, and in particular, does it involve your immune system, or does the treatment of your condition involve suppressing your immune system? For example, there are a number of autoimmune disorders like psoriatic arthritis, rheumatological conditions, and so forth, that part of the medication is to tone down your body's inappropriate immune reaction to its own cells, to your joints or skin or whatever it may be. And so for individuals who have an autoimmune condition or who have anything influencing their immunity, they should certainly consult with their physician before getting the vaccine. If you have a serious chronic condition affecting your heart or lungs, in addition, also I would suggest seeking the advice, and your employees should seek the advice of their personal healthcare providers before getting the COVID-19 vaccine. Next slide, please. Should I also get the flu vaccine this year? Absolutely. And, I note that, because you're in the Southern Hemisphere, you folks are now heading into winter. And so now is, the time to get this. And there's several reasons for this. I say because, firstly, you do not want to get co-infected with SARS-CoV-2 and the annual influenza virus. That's a double assault on your lungs, double assault on all of your systems. And we've been blessed, frankly, that we did not see that this year in the United States in particular, where the virus has been running rampant in the first year. And it was a great blessing because we suspect that the mortality would have been much higher. And we attribute that, frankly, and including also a significant reduction in the common cold and other respiratory infections due to the good preventive practices that the population has adopted around masking, social distancing, hand washing. If we would do that every year, the flu epidemic that we all experience every year would probably disappear. And with it, at least in the U.S., that can involve 10 to 30, sometimes 40 or 50,000 deaths a year. So absolutely, get the flu vaccine. There's no interaction between the vaccines of any negative nature. Protect yourself against both of these pathogens. This is not a time to get either. Next slide, please. When will we be able to travel overseas for business? So that is going to really depend, firstly, on how many countries reach what we call herd immunity, where 80+% of the population has been vaccinated or has immunity from prior infection. When that level of immunity occurs in a population, it so reduces the community transmission of the virus that it reduces everyone's risk in that particular setting. So this is a difficult question to answer because we are seeing surges in some countries. And so if an Australian wants to travel internally in Australia, obviously that's very different, or different than traveling to another country that has done so well, like New Zealand. But if you're traveling obviously to Europe or to Canada or to the US for business, I think it's too early to say when that travel will be possible again in a fully safe manner. Even if you're vaccinated, the governments will obviously err on the side of overprotection of their own communities, and we don't yet have an international regime for documenting a past history that you are vaccinated. Whether that will emerge through international agreement or not is yet to be seen. Next slide, please. When will the pandemic end? Well, obviously, it'll end when most of the world is attained that 80+%, preferably 90+% of either having been vaccinated or having been infected and having their own immunity, and sustaining that level year over year if we need to provide booster shots. So we're still quite far from the end of this pandemic on a global basis. And we're going to talk in much greater depth in the balance of this presentation. I'll give you a better understanding so you'll be able to judge for yourself as information continues to come forth how things are going. Next slide, please. What are COVID-19 variants? Why should I care about variants? And what is vaccine evasion? So as I alluded to before, and we're going to talk about this in greater depth, this virus evolves. And actually, you might progress to the next slide, if you would, because I think we dive into that. And the next slide, please. So just to get right into this. So the variants of this virus are mutations that are occurring in the virus's genetics, in its genome. And this is a natural process. This occurs in all living organisms. We're constantly mutating, and some of those are adaptive, some of those are maladaptive. What we speak of variants, of concern, or VOC, that's a term for mutations that fundamentally alter the virus's characteristics and specifically cause it to behave in different ways that are significant to public health and to disease control. You've heard about these variants. There's the variant that arose in the UK, B117. There's the South African B1351 variant and P1 out of Brazil. And each of these has changed in a way that is significant to public health. When we speak of ways that are significant, we're referring to making the virus more infectious or transmissible from person to person, as causing more severe disease and hospitalization, or as being more deadly and causing greater death. That's why we're concerned about variants. And frankly, if you follow the news on variants as individual leaders of your occupational and employee health units, if you just follow the news on the variants, you'll get a good understanding of how we're doing in controlling this pandemic and putting it to bed permanently for humanity on a planetary-wide basis. Next slide, please. So as I mentioned, this just illustrates that these are the things that that we are concerned about. It basically changes the effectiveness of our treatments of the virus, and it can also change the effectiveness of vaccines. And that is obviously all of these VOCs are of concern. A more deadly virus, a more infectious virus is very much of concern. And the UK virus, by the way, is now the dominant variant in the United States. And that just occurred in a matter of months, that in a population of 330 million, it could become the dominant variant. So those are clearly of concern. And obviously limiting the effectiveness of treatments is a concern. But the greatest concern is that our primary attack modality to control this pandemic, vaccination, can be undermined by the if a variant arises that can evade the vaccines substantially. In other words, the vaccines we have today are no longer fully effective or effective at all against a new variant. Now, of course, the vaccine manufacturers and the international public health community, including the Australian public health authorities, are working and collaborating so that we are anticipating that this is going to occur. And so vaccine manufacturers are getting ready to quickly introduce a potential booster vaccine that will be effective against any new variant that arises. But this is obviously something of real public health concern. And this is more than almost any other factor, besides the level of immunization we achieve as a planet. This is going to determine how quickly we end the pandemic. Next slide, please. Now, to understand these variants and this whole process, it's important to understand that the longer that the virus continues to replicate, and the greater number of people who are infected in whom the virus can replicate, that just is pure arithmetic. That is going to generate a higher total volume of variants in being created around the world, as opposed to if we had 90% of humanity vaccinated, there'd be a much lesser extent of infection. And the less infection, the less people, the less bodies in which the virus can interact with other DNA, your DNA, or symbiotic DNA that live in your bowels, for example, help you digest food and absorb nutrients and so forth. The less that happens, the better we are in terms of reducing the number of variants. So if we have high volumes of people infected, high incidence, we have high volume of mutations, we have a greater number and probability that there will be variants of concern, including one potentially that can undermine our current immunization capability. Next slide, please. The only way to effectively control, reduce, eliminate the emergence of variants is by reducing the total number of individuals infected across countries through mass vaccination or universal vaccination. Next slide, please. So now let's talk a little bit more about the disease and what we're going to face long term. And this may impact Australia, even though you've had much lower incidence. This is going to be a global phenomenon. And this is really about COVID, what we call long haulers, and the psychological impacts of this infection. Next slide, please. So COVID long haulers are individuals who experience really prolonged symptoms. In most people who get infected, the infection resolves in 2 to 3 weeks. In people who have this long hauler syndrome as it's starting to emerge, the symptoms can last 2 to 3 months or longer in some individuals. It affects individuals who had both mild as well as severe initial infections. It occurs in both young and old people. It affects those who were healthy before infection, as well as those who had an existing chronic medical condition. And interestingly, and this was a surprising finding, it affects those who were not hospitalized, i.e. less severe in their illness, as well as those who were more severely ill and who were hospitalized. Next slide, please. So these long-lasting symptoms of COVID-19 are referred to as this long haul syndrome, and it includes coughing, tightness in the chest, shortness of breath, headaches, muscle aches, and diarrhea, and it's accompanied by a very significant experience of severe and chronic fatigue. Next slide, please. These individuals, they feel very run down, they feel exhausted chronically, they're unable to exert themselves or to engage in exercise, and often unable to complete simple tasks like walking to their mailbox to pick up the mail. Now, you need to understand that this virus, SARS-CoV-2, it has the direct and indirect means or vehicles for damaging our bodies. It damages our bodies directly through viral attack in lung and other tissues. But it also causes an excessive maladaptive immune reaction. And what that means is your body, if you haven't been vaccinated, if you will, overreacts to the infection, to the virus. And instead of just coming in and if you will, with surgical precision, killing the virus in your lungs or in your, in other sites, what ends up happening is it stimulates such a significant broad bodily immune response that your own immune factors start to become problematic. They get into the lungs, they inhibit the appropriate transfer of oxygen into your blood and the release of CO2. This is as critical a problem as the direct damage the virus does, is the body's maladaptive excessive immune reaction. So this is the reason why, in addition to long haulers syndrome, we are beginning to see, it's being reported in the literature increasingly, a broad range of long-term organ or system injuries from infection, including potentially the spleen, kidneys, the cardiovascular system, and obviously the lungs and other systems. And this could even be a potential lifelong impact. We just don't know yet because we haven't had the follow-up data yet to observe this phenomenon. Next slide. So the net impact is that these individuals, as I say, they feel exhausted, they experience high stress, they may become emotionally and psychologically very anxious, they may be depressed and demoralized. I mean, who wouldn't with that kind of long-term experience after you've been acutely infected and possibly hospitalized? Other individuals who are not infected or who were family members of infected loved ones are obviously also experiencing psychological distress during this pandemic, as well as anxiety, fear, or possibly bereaving the loss of a loved one who died because of the virus. And of course, healthcare workers, these heroic folks on the front line, physicians, nurses, respiratory therapists, the entire team, they have their own set of oppressive psychological impacts that have been observed that are clearly contributing to accelerated professional, emotional burnout and associated issues, including possibly physical issues that they may be experiencing as a result of simply being caretakers for individuals who are infected while not themselves infected. Next slide, please. So these can impact, as I mentioned, anyone who has been, whether they've just been ill, whether they're a victim or a family member, with the variants emerging as well that could evade current vaccines. Mass immunization success may not reduce all of the perceived isolation, perceived vulnerability, fear, anxiety, and hopelessness, the depression associated with the pandemic. We hope it will go far to do so when we start to attain that herd immunity at the 80 to 90% level in all of our countries and then globally. But we think that this anxiety and stress experience is going to be longer lasting. Certainly as long as there are new variants being, be emerging from infected population. And just to throw you some numbers here on the prevalence of this, a big health system in the US, Kaiser, found 45% of US adults reported their mental health was negatively impacted due to worry and stress about the virus. Oxford University in the UK did an analysis of almost 250,000 infected individuals and found that over a third developed a neurological or psychiatric disorder, and 13% of those were first-time diagnoses, while only the rest were recurrences. Next slide, please. There's little data on the exact prevalence and nature of psychiatric illness in patients with COVID. Studies of prior coronavirus epidemics like SARS-CoV-1 and the MERS outbreak suggest that many patients with COVID-19 will manifest these kinds of psychiatric symptoms and disorders. One review of SARS-CoV-1 and MERS found in 60 studies that there were over 2,500 cases of such reported illness. And here at the bottom, I provide you a list of what kind of symptoms are experienced in these neuropsychiatrically: insomnia, impaired attention, anxiety, memory impairment, depressed mood, confusion, and altered consciousness. Next slide, please. The Kaiser survey also found difficulty in sleeping in over a third, difficulty eating, increases in alcohol consumption and substance abuse, and worsening of chronic health conditions. So this is all due to worry and stress over the coronavirus. Next slide, please. So the projected cumulative cost of lost productivity associated with this distress, with the hospitalizations, and the entire pandemic is expected to be well over $100 billion over the next 5 years. And of course, this doesn't consider mental health related reductions in productivity that people experience in doing their jobs and living their lives robustly. Over the next 5 years, the cumulative mental health services costs are projected to be over $50 billion, an excess of almost $900 million above what it would have been had there been no pandemic. Next slide, please. So what's next with this pandemic? Next slide, please. So, we should have been better prepared globally for this. Everyone should have been as ready and as effective as Australia and New Zealand in managing their national response. We've known about this possibility and emerging infections since the HIV/AIDS epidemic in the early 80s. That was the last major pandemic of an emerging novel infectious pathogen. I wrote in the journal JAMA 30 years ago in 1990 that the virulence of the HIV pandemic demonstrated the extent to which any sort of distinction between domestic and international health is really obsolete at this point. That the way we live today, increases in population, migration, travel, this makes disease fully mobile, both infectious disease and non-communicable disease, and both epidemic and endemic disease. And that's without even considering the effects of environmental deterioration. So the point really is that this concept of the global health village has never more aptly described our interdependent status around the world. Next slide, please. What will determine future course of the pandemic? Well, I've already talked about global vaccination levels. We need to get that to the 80–85% or above level. And so far, it's a very small fraction of countries that are reaching this level. And of course, the lower income nations are most at risk of not getting vaccinated. The U.S. has turned around with new leadership. It goes to show you what a change in leader can mean to public health. And now we have half of Americans have received at least one dose of the vaccine. That's half of 330 million people in less than 4 months since this new president has come into power. And that's a great accomplishment. And there's also a lot of discussion out of the White House of the need to partner with Australia, New Zealand, the UK, the world as a whole, to ensure that the lower income nations get the vaccine. Because, as I mentioned, with these variants, if these become more infectious, more deadly, or if one evades current vaccines, and with pandemic fatigue existing in all countries, none of us are going to be safe, really, until all of us are safe. And that means vaccinating the planet as a whole. Next slide. So the one silver lining of this pandemic, and I don't mean to trivialize the huge amount of suffering or death that is experienced, but there has been one silver lining that is easily identified. And that is a rapid acceleration in the adoption of telehealth, telemedicine, and virtual healthcare out of necessity. There were 6 million telehealth consultations in Australia from April to May of 2020. And in 2018, 2019, Australia only had 8.8 telehealth consultations per 1,000 people. That was well below Canada, for example, which had 72. Both of those are going to change now. The adoption of telehealth by providers, by the public at large, by insurers, everyone has realized that we were slow to take advantage of these emerging and amazing technologies. There are 25,000 health applications for the iPhone. There's enormous and very surprising things that can be done in telemedicine, tele-ICU, telepsychiatry, telecardiology, tele-infectious disease. It goes on and on. So we're entering a new era of medicine really now robustly, and it unfortunately took a pandemic to really drive that kind of acceleration. Next slide, please. So as I say, I believe it will continue to, digital and telehealth will continue to play a critical role in this battle. Next slide, please. Now, WellTech thinks about this all day and really not much else than this. We are a personalized digital well-being company. We have a robust smartphone application that gives users insights and assistance in managing emotional, psychological, and physical challenges. And we are in the midst right now of ramping up a specific focus on COVID-19 and supporting individuals' psychological stresses and anxiety around COVID-19. Our technology array leverages wearables such as watches and rings, other devices that are innocuous, machine learning and behavioral economics to really understand the kind of support, anxiety reduction, stress reduction that employees need, and how to simultaneously advance healthy lifestyle habits to reduce their risk of chronic disease and preventable healthcare utilization. Next slide, please. Our approach is to be proactive, personalized, to inject and ensure that there is meaning, that our engagement with our end users is meaningful, that they really derive value, and of course that it is scalable to all employees in a particular organization. This involves 4 overlapping and repeating steps: profiling and understanding the individual, their risks, their orientation, their stresses, their concerns, then engaging and influencing them through a multimodal outreach and media engagement, and then telecare. In using these technologies and using general practitioners and telehealth consultants to deliver needed interventions for those who need more than just psychosocial support, education, and the support that we provide daily through our application, where they need some more clinical intensity, if you will. We have the telecare component, and then analyze and advise from your perspective. And as employee health directors leading your occupational health efforts, we provide dashboards with intelligence, actionable intelligence that can enable you, partnering with us and others, potentially to invest more to drive better prevention and primary care behaviors in your population of employees, to reduce their stress, their anxiety, and to get them in better health through weight loss and other improvements, and to thereby increase their well-being, the well-being of their families, increase their productivity as employees, of course, and reduce their preventable healthcare utilization. Next slide, please. So we really obviously focus on, as I've described, conveying concrete, real value to employees, their families, and colleagues in your workplace. We've seen a 31% net increase in engagement from the use of our platform, increase in 28% in resilience, reduced intake of alcohol, significant stress reduction in half of end users, and 46% improvement in experience of fatigue. We have a leading organization as our customers and our partners. I won't go through them all, but you see their logos here. It's really a who's who of healthcare and of leadership in taking care of their employee populations. Next slide, please. Again, we really tried to emphasize a complete continuum of personalized care and engagement to drive these preventive improvements, to drive and ensure maximal wellness through this virtual healthcare platform. And we cycle through this as necessary as often in more and more refined manners and in more targeted manners over time based on the individual's reporting of what they are experiencing. And so, our philosophy is that today's wellness is tomorrow's healthcare, and tomorrow's preventable healthcare is determined by how effective we are in today's wellness achievement through your employee health units and through engagement of your employees. Next slide, please. So that's everything I had to say at this point. We'd be delighted to open this up for questions at this time if you have any. I thank you for your attention. I hope this information was valuable to you. And should there be any questions afterwards, I've in the little orange tag there with my name is my email address at WellTech. I'd be more than delighted to follow up with any of you should you have questions. Please don't hesitate to reach out to me.
Thanks, George. Some great insights there, and hopefully everyone's taken a little piece of knowledge away from them to have a better conversation, not only within their workforce, but certainly with their loved ones as well. Just encourage everyone, if you haven't done already, pop your questions in the Q&A sections on the right-hand side. We'll go through a couple of those which have already been submitted and any more which come about. If you see one which has already been asked, then please like it, and that'll continue to populate through. But George, we've had a great question come through from Dominic. Can you comment on the need for ongoing testing, even post-vaccination?
So testing will be required in really two primary scenarios. It will be necessary for individuals who remain unvaccinated, if they, for example, have some condition that would preempt their ability to be vaccinated. Those individuals are going to need a sustained monitoring, as well as anyone else who, if there are individuals who resist vaccination for, we have, unfortunately, in the US and I believe in the UK as well, an anti-vax movement where flawed science has indicated that common vaccines have caused conditions that they have not. So people may decline vaccination, and those individuals will need to have an ability to test frequently. And of course, as I mentioned, we're going to need to determine how long we have vaccine coverage from the initial regimen of vaccination. And individuals will have their immunity wane. They will get reinfected, and they will need to be tested to confirm that they are actually reinfected or infected for the first time with this coronavirus. So testing is going to remain an integral part of our healthcare system. And again, I mentioned the HIV/AIDS epidemic earlier. The way HIV/AIDS moved from initially being a pandemic that we were aggressively battling to control, to then becoming a chronic disease with life-prolonging therapeutics, systematic testing, and highly engaged prevention measures. That's how HIV/AIDS moved from pandemic to what we call endemic, just a part of the healthcare system, not an epidemic. I suggest that if we look to, even though this virus, the coronavirus, SARS-CoV-2, is much more highly infectious than HIV, because HIV is kind of bodily fluid to bodily fluid, and this virus is respiratory droplets, so a huge difference in transmissibility. I still think we can look to how HIV emerged into an endemic disease, and also an endemic part, if you will, of our healthcare and public health, national and local infrastructures. And so testing will be with us, I believe, into the indefinite future.
Great. We've also had one come through from Minnie. Vaccine during preconception or if pregnant, is it safe or not?
So this is something that is still, I think, being examined and studied. I think you need to look. I'm not aware of a change in it yet. That is something that I would consult with your prenatal care provider and determine if that's suitable for you. I would definitely explore it. I believe ultimately and I think the evidence is already accumulating that this is not harmful or involve any risk to the developing fetus. And so I would expect most countries to be engaging in prenatal vaccination for COVID-19 imminently.
Great. Another one's just come through. So you mentioned again, and through some of those slides around the physical aspects of the virus, and certainly the long haulers and the mental health aspects of it, with depression and anxiety and the stresses attached to that. How do you see COVID impacting the future workplace? Certainly there's those lifestyle behaviours and some of the side effects there, but also around, will it be mandatory that everyone has to get a vaccine to come back into the workplace? What does the future look like from your eyes?
So that is going to, it's a very complex question. I would say a couple of key points. I think if we are not successful in achieving vaccination of our national populations around the world to the 80-85+ % level, we're going to continue to have epidemic infection, epidemic coronavirus. How that is accomplished will be determined by national governments. I'm a public health professional, I'm an epidemiologist, I'm a physician. I would like to see mandatory vaccination. And that is an issue around personal civil rights, obviously has implications there. I'm not saying for individuals who may engage any risk of vaccination, who have, so for example, an underlying, disease that could be impacted by vaccination or an autoimmune condition. But for, generally healthy people and most people with chronic diseases, I think most epidemiologists and public health personnel around the world would say, absolutely, it should be mandatory. As to how it'll affect the future workplace, it'll depend on the extent to which we achieve that latter objective. Will this be something we're going to have every year, a winter epidemic like we do with influenza because people are not getting vaccinated appropriately? Then it'll have a significant impact on the workforce. I think the psychological stress and anxiety aspects, the psychosocial, psychiatric aspects, whether or not you've been infected, are going to remain in our culture for years hence. We're going to be dealing with the fear that this pandemic has created. And I believe that's the case even in countries like Australia, who were particularly blessed with strong, early, and aggressive, effective leadership to control a disease transmission within your communities. Having said that, I also want to point out that, again, there's Australia and New Zealand, these countries' admirable success is no basis for complacency. And a new variant coming on board, how many years can countries go where there's no travel between themselves and other countries? How long can the global economy be sustained where every country is just living within its own borders? We'd be living in a very different world, and it will have economic impact and industrial impact. So I think we're ultimately moving to a world where we have to educate people to understand why they need to get vaccinated, how low the risks are of vaccination. We need to bring them along just like we did for smallpox and polio before that. This can be done. We need to be rational in our approach. We need to overcome the skeptics, the anti-vaxxers, those who have fears. But ultimately, yes, I think, if it comes to it, if it's required, I think national governments will be proactive and will require vaccination.
Yeah, look, interesting as well. There's Fair Work Australia, I see, has just put out a guidelines around making the vaccination mandatory within the workplace. So for those who haven't seen it, certainly have a look at the Fair Work Australia guidelines and what their stance is on making that mandatory within the workplace. George, 2 minutes left in time. So look, I guess the last question, which, there's been a few come through, and certainly we'll reach out to individuals to answer any of those, or feel free to reach out to George or myself for any other questions which you do have post-event. Last question, though, in the last sort of 60 seconds before we wrap up, was people are the 12-month period with booster shots. How important is it to get the vaccine of the initial one which you took?
So it's critically important. If you get a one-dose vaccine, the J&J, or another one dose, you're fine 2 weeks after you've had the vaccine. If you get a multi-dose or the two-dose vaccines, either Moderna or Pfizer, you must get that second dose, because that's what really kicks up your immunity to that 95% level, really enables your body to respond effectively and destroy this virus, make it innocuous when you're exposed to it. So it would be 2 weeks after that second dose. As to when we will need the booster, that will be determined through follow-up of the vaccinated populations around the world. The thinking is it will be potentially 6 to 12 months from completion of the first vaccine dosage received. But that clarification will be coming forth in the next several months and widely publicized around the world. Perfect.
Awesome. Look, once again, thanks so much for your time today, George. I'll hand it to Tanya to wrap up and so for some last minute words.
Thank you, Dr. Gellert and James, for joining us today, and especially to you, Dr. Gillett, for providing such a clear and updated view on COVID-19 for us within our communities and within our workplaces. Thank you very much, and thanks to you, James.
My pleasure.
Thanks. And a quick reminder to everyone who's joined us today that we'll be running another webinar next Wednesday, same place, same time. In the topic with this time will be understanding financial wellness in the workplace. Another reminder also to register for the main event, Workplace Wellness Festival 2021. On the 22nd and 23rd of June, we have over 100 speakers across 6 conference tracks and a jam-packed program for you. So make sure you register for yourselves and your teams. And finally, a very big thank you for joining us. We hope that you enjoyed the content and the topic today, which is very timely. I think it's on everyone's minds day to day. So yeah, a big thank you and enjoy the rest of your day. She's waiting.